All the time here on the exam room, we get messages from doctors and dietitians curious about how can I incorporate this into my practice? How can I incorporate lifestyle medicine and nutrition into my practice? And the answer is there are a number of ways to do it, but there's also the reality that it's not always the easiest thing to do. And I have the perfect guest to talk to us today about that. She is somebody who is well versed in this, who has been living it now for a number of years. And with that, I'm so happy to have Dr. Laurie Marbas here on the exam room. Thanks for joining us.
Thank you for having me. I'm excited to be here.
True or false, it can be a real challenge incorporating lifestyle medicine sometimes.
Yes. Starting, about 11 years ago in just a regular practice setting where I was at a hospital doing hospital medicine, nursing home. Then it was a challenge. Then moving strictly just to clinical practice, that was a challenge. And then off to telemedicine, starting my own company, using just cash, using insurance, you name it. It's all challenging, every bit of it.
Absolutely. Is the appetite there? Is it the fundamental that because not a lot of people are prioritizing nutrition, it's more difficult to have enough patients to make it a viable practice?
I think there's several things that you need to address. First of all, if you're in a regular, let's say a family medicine practice, I'm a family medicine physician, you will have plenty of sick patients. Now, the art is finding those who would incorporate it into their life, but you will always have patients and you will always have a paycheck because insurance is paying for sick people to see the doctor. The strategy is, how does a doctor who's just wants to help patients get better do this in their regular busy clinic? Do they have to step outside of time, outside of clinic to actually provide that care, which I've been known to do on more than one occasion? Or do you really just limit who you speak to in a day because you only have so much time? You can only go over each visit maybe 5 or 6 times before people are knocking on your door and saying, hey, we've got 3 or 4 patients waiting for you in the waiting room. And then the other piece of this that I often get questioned is about, well, how do I do this in this setting or this? Because everyone's working in a different type of setting. And then how do we get insurance to pay for it? I have less concern about the insurance paying for it. It's a matter of, how do I help these amazing, talented physicians provide the time and figuring out how to make it work in their ecosystem?
Because insurance, typically, if they're covering something, like if it's a standard visit, it's really only a 15-minute visit, correct?
Right.
Does it take more time to do a comprehensive visit with somebody because it's lifestyle medicine and it's not just script and rip, basically in and out the door?
Right, script and rip, that's right. I would say it really depends. So the way I actually had to evolve my practice when I first started doing lifestyle medicine, I would say more plant-based medicine, about 11 years ago. So I was about 10 years into my career. And what I found was that I had to condense what I was going to say into some 3 bullet points. And I had created like a 30-page handout. Might have killed a few too many trees, but I just would highlight the 3 things that I knew that would move the needle the most. And then I had short follow-ups. So I would go through my daily calendar and I would pick, 5 or 6 people that I knew would be open to this conversation. And I had already kind of planted the seed. They were already eager to be either stopping medications or looking for alternatives. And it's like, okay, can you do these 3 things for me? Mm-hmm. And they're like, sure. And it's like, and I need you to come back in a week or 2 weeks, depending on, what medications they were on. And that's how I started actually doing the practice. And over time, I was able to develop a lifestyle medicine clinic at a larger hospital. We did a short study in this little rural clinic in Rifle, Colorado. And that's kind of how it all started. And then I was just looking for other opportunities in other places to practice this and see what would stick.
What are some of the other obstacles, though? Because we have seen so many of these practices, well-intentioned, whether they be telemedicine, whether they be brick and mortar, plant-based, Ray-Rod, there's this buzz within our own community, but sure as fire, like within a couple of years, they're really struggling to keep their doors open and the website up. So what are the obstacles that typically people are facing here?
I think honestly, it's really how we approach the patients and who we're looking to do, because we get really excited about sharing this with everybody. So you need to really be thinking about who is the patient that you want to proceed with the message. How are you actually giving it? So I always tell people you have to be really good salesmen, right? So I may have, let's say, a Volkswagen for sale, and I have 3 different customers. I have the teenager who wants to look cool and be the Volkswagen, be the thing. I might have a mom with 3 kids who's looking at safety and, saving money. And then the elderly person, whatever else is, I'm not sure. I'm getting into that elderly stage. What would be important? I guess reliability. And so that might be the same vehicle, but I'm going to have a different sales pitch, right? So a good example is I have 3 kids. They're all plant-based. All 3 of them came alongside of my message with different reasons. The youngest is an ethical vegan. The middle one's like, it's just a good thing to do for my health. And the oldest is a climate change, really. Mm-hmm. And she's also a physician, so she understands that value of that message for her patients. But the piece of this that's really important is understanding you need to tailor the message that's going to really get the interests of the patient and speak a different language. That's one piece. But the other one is also, how do you do this and get the patients to understand that this is really important for their own health? But it's not just the goal of weight loss. It's not just the goal of stopping medications. This is really understanding that this is going to provide value in your life, and it's going to really help you do the things that you want to do. Like, let's say you really want to spend time with family and have the energy to go hiking or travel or be there for your grandchild's graduation. Those are the values that I try to help people emphasize when you're changing the lifestyle, because it's more than just changing your diet. It's really changing your lifestyle. It's not a short-term fix for a long-term problem. It's a long-term change in your lifestyle to really see the needle move in their health. But once they get it, they're the best advocates for you. And I think that's where the group medical visit is also really helpful, because now we're putting people in an environment with their peers and they help spread the word. And that's how I was always successful, because I lived in a smaller communities. I always had group visits, and that's where I was really excited to see the needle move. And I think that's where corporate medicine can be very helpful, right? So that's kind of my next adventure, is moving into the corporate space where you can actually help employees in a group setting.
So for those of us who aren't familiar with the group medical visit, what is that? Does everybody gather in a room together and ask questions, or how do they work?
Yeah, so it's typically between an hour to 2 hours, depending on exactly what you're going over. You may have 10 to 12 patients. Most of the time, they're going to have some disease process or chronic disease thing that's in common. Maybe it's diabetes, hypertension, heart disease, cancer. And so then you can address that specific disease. You can save some time. But the pieces here is there's an educational component, absolutely. But the more important piece is how the patients kind of take over the appointment and they help each other. So you may hear someone saying, let's say if they're diabetic, like, man, I just can't get my blood sugars under 200. And I'm really struggling because after work, I'm tired and I don't want to cook. And someone's like, well, this worked for me, right? They'll talk about batch cooking, or they'll say there's a food service or their co-op or something, that they've done. Or maybe they go walking in the evening to help their blood sugars get down. So those are the type of things that you'll see. So it's not me telling them. It's these other people who look like them, who are dealing with the same issues or on the same medications, all sitting together saying, wow, you're in my community, you're working where I work, and this is amazing, because if I know you can do it, I can do it too. And then they kind of have also that accountability to each other, because they don't want to let each other down, way more than I think they would ever consider worrying about if they let down their physician.
Right. I think back to a weight loss support group I went to after I had bariatric surgery. I always prided myself in kind of being the leader of this group. I was a competitive guy, still am, and I always wanted to be the one that was like really losing the most weight and sticking to the program the best, and just kind of, I wanted to be the role model for others. And, not to be super cynical, but it was kind of deflating at times when I would show up and I would try to be this leader and I'm on the straight and narrow. And then like other people were talking about ways that they could game the system and reintroduce some of these foods back into their diet, but not too much, because we don't want to go back to why we had to have the surgery in the first place. Right. But nonetheless, I saw everything from Sprite and Diet Coke to Swedish Fish and, French fries come out in these group settings. But the interesting thing, though, was that the dietitian who was also part of this group was like, you can eat these things just less than you were.
Oh, that's interesting.
But it's like, well, of course it's going to be less than you were. You're talking to people who are only like 6 or 8 months post-op. Like, no way they can eat the same volume of food at this point that they once did. It would take years for your stomach to stretch back out, and the stomach does.
Right.
But it's like I could already at that early point after the surgery see this clear delineation between the people who were probably going to be successful long-term and the patients who more than likely were going to have to come back for what the surgeon described to us in the initial consultation as a revision surgery, which essentially you get your stomach stapled a second time. Not exactly the most appealing option, yet the draw of that food is so strong that people opt for that. And they're like, well, I'll do it again, and I'll just come back for the surgery a second time, and then I'll make those changes.
Wow.
Like, that's kind of crazy, isn't it?
Right. No, that's insane. But it's also, I've had a patient that literally was having elective CABG or, artery bypass, coronary artery bypass. And I was literally sitting here talking to him saying, you could switch to a whole food plant-based diet. We could potentially, reverse your disease or halt your disease where you won't have to have your chest cracked open, veins turned inside out and harvested from your leg and put into your chest and shut back up with wires. And he's like, I have no interest.
Yeah.
And so when you sit there and understand, as a physician, it's disheartening, but at the end of the day, I know that I've done my duty, right? I've provided all the alternatives and tried my best to at least encourage them to try it. And if they choose not to, it's their life to lead, and I can't, feel bad for that. I just know that I've done everything I can, and I can sleep well at night because I'm a big fan of sleeping through the night. So if I don't do what is right, I don't sleep well. It's like this consciences kind of thing.
Yeah.
So as long as I'm providing all the alternatives, just like anyone who has, let's say, cancer, right? They're given all the alternatives. If you withheld something, that is malpractice, in my opinion. So it's really important that I speak to every patient regarding everything we can do to improve their life.
Do you think by and large, and I promise we'll get back to the topic of the day, the business of lifestyle medicine, but do you think by and large the average physician understands the pull that food has for the patients and why, at least in my biased opinion, admittedly, that's kind of why we're in this health pickle that we are in by and large?
I think actually they do. And
Really?
That's why they don't actually present it as an option, because they don't think anyone's going to change.
Damn.
So instead of thinking the opposite and saying, wow, actually there are people who change, and maybe this is the person that will listen to me and I can help this one life, right? And who knows who that person's going to influence. They just write it off and saying, well, nobody's going to change because food is addictive. Nobody wants to give up their French fries, their steaks, whatever, Taco Bell. And
Amen.
And so when it comes to that other, the thinking on the physician side, we have to understand they're also human. So they're also dealing with their own thoughts and feelings. And, they're almost forecasting for the patient their decisions. And again, it comes back at the end of the day, it's not the physician's decision, it's the patient's. And it's the physician's job to provide all the opportunities to change their life, be it a prescription, written prescription for drugs or a lifestyle prescription.
So here's the thing. We know that the pool of people who eat a very clean, healthy, whole food, plant-based diet, we're talking like a fraction of a percent of the population. I think maybe 2% of the population right now is either vegan or vegetarian, right? So that's a pretty small pool. So when you're creating a lifestyle medicine practice, that is a small pool to begin with. And so I feel like when all of these came online, everybody's kind of vying for that same 1 or 2%. In order for a business to grow, whether it be this or any other, you have to go outside that bubble. So how in the world, and I know that this is something that I'm sure there may not even be an answer to yet, but how in the world does somebody then crack outside of, that group, those P1s, as I like to call them, to grab that 98% who need to hear this message? Because God knows you look at the health statistics and you're like, there's a lot of people out there that could use some better advice.
I think, would you be surprised if I said GLP-1s might be an answer?
Talk to me.
So it's interesting, right? So I was a co-founder of Plant-Based Telehealth, and which was, plant-based people. You saw it in the title of the company. We were very successful. I sold it to John Mackey last summer, and then I started more on medical. We wanted to utilize insurance in providing group medical visits across the country, starting in Florida and Texas and California. And we were successful. So the patients that we saw were the ones, the low-hanging fruit. But most of these folks came from email collaborations with Forks Over Knives, the Food Revolution Network. So people who had already kind of, they drank the juice already. And the problem was when we started reaching outside of that, the message was almost too much for people, right? They're like, you want me to switch to a plant-based diet? Because we're going to be pushing the healthiest optimal prescription. But what's interesting, though, we ended up having to shut that down because we didn't have a steady flow of patients. We had tried all sorts of things. You name it, in social media, we did TV, radio. We even partnered with doctors and, looking for referral patterns and sources, and none of that was working. But what is interesting, though, when you speak to patients, and now they want to lose weight, right? And they're looking for the GLP-1s, these drugs that cause massive weight loss and other things, right? They decrease the desire to drink, they decrease the desire to go shopping. So I have some other thoughts on what might come of that in the future. But
really,
anyway.
if there was a perfect drug, less drinking, less shopping. Come on.
For people who are, when these are a problem, right? So you'll see people's addictive behaviors start to decline because they just lose that drive, which makes me curious about other things like depression and anxiety, but that's another conversation for another day when we have more data. But what's interesting, they're very expensive drugs. So if you're speaking to a self-insured employer, and now all these doctors are prescribing these medications off-label, meaning for someone who doesn't have diabetes or prediabetes, and the self-insured employer is going, whoa, all of a sudden, their healthcare costs are just really going through the roof. Well, now what do we do? Well, we need someone to, now we're looking at lifestyle medicine saying, hey, that's a great answer. Well, how do we combine the power of that? So we use the carrot of the drug, right? Because people will do anything to get the drug. They'll even stay, interesting study, in an unhappy employing setting, like where they hate their job, just to be able to get coverage for the drug.
Whoa.
Okay, so that really speaks to what people are willing to endure to get a drug that they see as valuable because it's the weight loss that they really are seeking. But if you do like a step therapy, right? If you have a lifestyle medicine program that, okay, you can have the drug, but you also have to do the lifestyle medicine program. You have to show up. You have to show that you're actually doing the work and incorporating it, therefore to continue the medication. So we have them, we're meeting them where they're at. They want the prescription, we provide it, but at the same time, we're providing this most valuable education. So they're gonna walk away with at least the knowledge. Now, at the end of the day, whether they engage in that or not, but I think it's a compelling message, right? Because now we have someone who understood the drug helped them get started, they don't have to have the drug forever, right? We can incorporate these lifestyle medicine interventions, this amazing prescription for life, and you can stop these medications with sometimes the nausea, the nasty side effects, potential thyroid cancer, other things.
Oh, yeah.
That is where I think that we might find a really valuable space to get outside of the low-hanging fruit of someone who's already welcomed a lifestyle change.
You are speaking my language. And while I had bariatric surgery, it's much the same. What we were talking about, that clear delineation between long-term success and short-term success, right? Anybody can be successful having bariatric surgery. Like, it's basically bulletproof the first year and a half. Like, no matter what, you are going to lose weight. Over time, though, the weight starts to creep back because you never make those modifications.
Right.
And so when people ask, like, well, how do you lose weight? It's like, it's not about losing weight. It's about how to keep it off. And so whether you use the weight loss drugs, the Ozempic, the Mounjaro, whatever the case may be, you have bariatric surgery, whatever the intervention is, it's always in the end going to come down to the two things that you've been told are healthy your entire life. It's diet and it's exercise. I'm sorry, that's not the pill that a lot of people want to take, but it's so true. But you know what? I think that when people are having success initially and they're feeling really good and their confidence is really high, that's the time to strike and explain, you're here now and you can stay on top of this mountain. Here's how to do it. I think that you're onto something, Dr.
Now,
Marbas.
imagine if you're in a group of people who are experiencing the same thing, and your insurance company and your employer is saying, we're not paying for it unless you do this. So there's so many positive movement in that direction, so that I don't think we have a choice but to be successful, right? Because people want it. The employers are saying you have to do this to get it, and they're like, okay, whatever. And it really comes down to the end of the day, making it a feasible option for people, and that is where our specialty comes in, is helping people understand this is going to be cheaper, you're going to feel better, and it's not only helping you lose weight, but it's decreasing everything else, your heart disease risk, your cancer risk, everything. And so I consider it a win-win, and I'm in the middle of some corporate pilots now, and they're going great. So I'm super stoked about that, and yeah, I'm excited to see where it goes.
Yeah, you should be. And I think about just the enormous burden on healthcare cost of this country, and how at the end of the day, it's like, even as recently as a month or two ago, they're talking about slashing Social Security once again, and it's just like, well, what happens if these medical costs weren't as exorbitant as they were? Couldn't we then make sure and ensure that that financial blanket was there for tens of millions of people, right? So if we're able to drop that dollars, it seems to me like lifestyle medicine, as you're describing it, is a heck of a solution.
Right, absolutely. And part of our prescription is not only the educational piece, but it's, of course, the group medicine piece, right? So they're working with each other, but also providing plant-based meals. So we can show them in the first 4 to 6 weeks that these meals are tasting good. It gives us time to educate them, so they're getting healthy meals. We're getting rid of that physiologic dopamine craving addiction, right?
That's the hardest part, man.
Right?
Absolutely.
So you got the drugs helping, you've got the education, you're feeding them healthier food. Because I always believe that if you put someone on a whole food plant-based diet and along with the proper education, that was the really crucial factor there, is because they're getting all of it together. It wasn't just a matter of, calorie restriction or just giving them education. You got to show them that the food tastes good and you're getting rid of that physiologic feeding.
Yeah.
But the really important piece here is that we're providing food, allowing them to taste it, and it tastes good. And their taste buds change, and they're like, wow, actually I have more energy, and I didn't have to have surgery, and now I don't have to stay on this medication for the rest of my life. Now they may, depending on the patient, they may need 3 months or 6 months or 9 months, depending on the weight loss. But, like we've all said, we know people, and I've had patients, one in particular that comes to mind is Nikki, who's I've actually had on my podcast as well, who lost 350 pounds just changing her diet.
Nikki!
Yeah.
Go ahead, Nikki.
Yeah. So she was 509 pounds when I first met her, and that was 2017, January 2017. Within 3 years, 350 pounds lighter. And incredible human. And so, but we all know these stories of 100 pound, 200 pound weight loss, and it's a wonderful way to go outside of again, people who've drank the whole food plant-based diet juice and really utilize the drugs to our advantage. And I'm kind of, in a weird way, it's going to be weird for me to say this, thankful that they're so expensive, because now employers are looking to force another message and education, right, where they may not have otherwise if this was just another, $50 drug per month or something.
Definitely not $50 a month.
No.
Definitely. I think, the average person really only stays on these things for like a little over a year, somewhere in that ballpark, because one, the cost, but two, the side effects on these things can be hellacious as well.
Right. But if you think about that though, so let's say they stay on it for a year, what's going to happen after the year? If we haven't done the educational piece and shown them that the environment can change, it's just a choice. Yes, is it hard? Of course it's hard. But again, if you work in your community, work in your, where you're working to build an environment of healthier food choices. I mean, working in a hospital is the worst, right? There's unhealthy food choices in every vending machine around every corner. But if you look at this in a year's time, when someone comes off of it, they're going to gain the weight back, right? They've also probably lost muscle mass because it's such a dramatic and rapid weight loss. And so now we've got less muscle mass. They're probably at a higher body fat percentage than they were the prior year before incorporating the medications. And so that is a concern too, as now we have someone who's lost weight, gained it back, and they're in a worse place than they were in the beginning.
Can we just like rewind what you just said? You lose all that weight, less muscle mass, higher body fat percentage, even though you've lost a lot of weight. That is mind blowing to me.
Well, people think, well, if I lose weight, it's just fat. It's not, right? Unless you're very careful and do a kind of a slower weight loss, right, where you're doing a controlled, there will be muscle mass loss. And if we're having someone who's not being educated on the importance of weight resistance training, making sure they're consuming at least enough calories to preserve, and especially the protein piece on the muscle mass, we're going to have muscle wasting. And so now we've lost this rapid weight loss. We've got some muscle mass loss. I know it's like a little difficult to say, but now they go back to the way they were eating before because they stopped the medications. They can't handle the side effects. And now they're going to gain the weight back, but they have less muscle. It's harder to gain muscle than it is to gain fat.
For sure.
All are fully aware of that.
Yeah, man.
So we're at a worse state than we were before. And I don't know the exact percentages and stuff, but I do know that's a great concern. And yeah, it's something to speak very seriously about with patients when you're prescribing these medications. Is like, let's look at how quickly you're losing the weight, and let's look at your body composition and what's occurring underneath the skin is an important thing to talk about.
I love your approach. I want to wrap up with this, and that is, as you're approaching these corporations, I imagine, do you go in there with a cost analysis and say, well, look, if you implement our program, odds are you're going to be able to have this effect on your healthcare costs.
Right, absolutely. So we look at the general healthcare cost of the GLP-1s. We look at kind of almost like an N of one. You can take the patient, what was their cost last year and what will be their cost afterwards. And there can be a value-based care kind of system, right? So there's interventional costs that we would get paid up front, and then you have a value-based care solution for long-term to help the doctor stay in touch, or coaching or whatever it is to help the patient maintain that lifestyle. So again, they don't, walk into, let's say Christmas or the holidays or dealing with family or whatever it might be, and go back to their old habits, because it's super easy to slip down, like you said. Just a little bit of French fries, a little hot dog here and there.
It is a slippery slope, Doc. Oh my gosh.
But then that at the end of the day, let's say 1 year and 2 years out, if that patient has continued to maintain weight loss, reverse their diabetes, have a lower cholesterol, lower hypertension, less medication costs, they're more attentive, they're attending work, they're less absenteeism, they're more productive, there should be some costs shared or cost savings shared amongst the whole team that helps provide that opportunity. And so that's the other piece that we're looking into, is creating a different model than the fee-for-service that's what we're stuck in our current medical system, which is killing us financially.
For sure. Is it possible to say like 20% savings, 30% savings, anything like that?
I would, it really depends at the end of the day what we're dealing with and the severity of the person. So, but even if you're just looking at just the cost of the GLP-1s, let's say we have an average cost of, let's say $750 or $800 a month. Let's say that the intervention cost, I don't know, $1,000 a month for 3 months or 6 months or whatever your intervention length is. You look at that over the cost of, 1 year, 2 year, 3 year, it doesn't take very long to get all your money back. Plus, you're getting all the benefits of improved health. It's not just weight loss, it's improved health. Their diabetes improves, their lipid panels improve, their biometrics improve, the blood pressure decreases.
Yeah.
And, I did occupational medicine as well. So then you have less work injuries because people are more attentive. They're getting better sleep, right? So now their relationships are improved. But by default, typically now their families are going to be better, right? Because I call it positive collateral damage. When someone who lives with you, who's eating better because of you, loses weight, reverses diabetes, decreases medications, hypertension, there's cost savings also outside of that we don't even think about, because that employer is probably paying for their family members' healthcare as well.
I love the way you put that, positive collateral damage.
Yes.
Yeah, that's a happy little phrase right there. So I think there's probably people watching right now. Maybe they're business owners themselves. Maybe they're other physicians who just want to pick your brain, but particularly business owners who are interested in like, I like what she's putting down. I want to scoop that up for my company.
Yeah.
How can people find you and get in touch?
Yeah, absolutely. They can contact me at Laurie, Laurie, at drmarbas.com. That's DRMAR, B as in boy, AS.com.
Right on. What else do you have going on? I know you're a super busy person.
Oh boy. Well, apparently I can't walk away from startups for whatever reason.
You got the entrepreneurial spirit.
I do. And it's a bit of addiction. I enjoy working for myself and then, taking an idea and making it come to fruition. So I have partnered with a wonderful young woman, and Brittany Giroudi. And
Love Britt.
She's lost 70 pounds on a whole food plant-based diet about 8 years ago. And what was amazing is she took to the kitchen, right? So healing began in her kitchen. Mm-hmm. And so as we were talking and as we were shutting down Mora because we were having difficulty with the individual patient versus the corporate piece, I was like, really should work together, because the two things I often hear are super helpful is people want to know about recipes and how to cook. And then they have a ton of medical questions. I was like, we should, kind of work together. You've got the recipes because people love you. And it's called the Giroudi family. That's what her, typically her Instagram and YouTube channel. It's a fantastic following, delicious recipes. And I could come in as a physician and answering the questions. And so we created what's called the Healing Kitchen. And so we meet live every Wednesday with our members, and you can find more information again at drmarbas.com, click on Healing Kitchen. And we provide 2 recipes. We cook together for the first half hour, and I'm answering questions the last half hour. And actually it's a lot of fun. We get a lot of fun and crazy questions for sure. But she's elevating my cooking game. And I feel like I'm a pretty good cook. I had to bring this diet home 11 years ago to, 3 teenagers and my husband at the time. So I really pushed the boundaries. But now she's like, like last night, I was here, so I just got to observe. I didn't get to cook. Was like, she had eggplant, roll-ups, looked like a lasagna, and this amazing, beautiful peach salad. And I was like, wow.
What?
Usually I'm buying and cooking, and I'm like chowing down while she's cooking.
Yeah, right?
But now I was like just salivating by myself in my hotel room, watching everyone else enjoy it. But it's a lot of fun.
Man, well, I'm thinking you elevate that game a little bit more. It could be fun to see a cook-off.
Yeah.
Doc. Right.
No. I'll leave the cooking to Brittany, and I'll just enjoy the again, this is a positive collateral damage, is me getting to eat healthier.
Right on.
And do everything I can. Yeah.
Oh, she's such a good cook, too.
She's
she is
amazing.
such a good cook.
Just
so
delicious.
good. All right.
Oh, I can go on.
Dr. Laurie Marbas, thank you so much for your time. This has been great.
Thank you. Appreciate it.
If your health IQ is a couple of points higher than it was a few minutes ago, go ahead and like this video or subscribe to the YouTube channel. And to take it even higher, head over to Apple Podcast or wherever you get your favorite shows. Look for The Exam Room by the Physicians Committee. Hit the subscribe button there as well and help to make your world a healthier place.